Hello friends, it's a pleasure to have you back on the channel of Clinical Care Insights. In our today's lecture, we are going to discuss about one of the disease which is occurring in the neonates, that is called as neonatal seizure. Before I'm going to in depth about the today's lecture, I want to inform you all that we already uploaded most of the clinical videos related with the anatomy, physiology, pharmacology, as well as the some of the diseases. And we also have the podcast related with the medicine and a certain of different branches like the nursing. So I invite you all to come to our visit to our channel and enjoy all the videos. So let's start today's video without wasting the time. So the disease, as I said, we are going to discuss is the neonatal seizure. Basically, we will discuss the neonatal seizures in detail about the introductory part, what it is, and their incidence, their epidemiology. We will also discuss about the sign and symptoms, how to diagnose it, what are the management ways. Okay. Now, so this is a quotation which I try to link to the pediatrics. Basically, pediatry is a medical specialty which dealing to how to cure the diseases which is occurring in the neonates. The quotation is: a child comes into the world craveling and without the teeth, obviously, and the old man gets out without the teeth and craveling. Most of the time the extreme are alike, okay, but the one has no experience of the life before him while the other has gone through it all. Means basically this quotation says that a child is coming in this world and old is coming out from this world. Child is coming with craveling and without the teeth, because we know that the teeth eruption started by the 6th month. Okay, so baby comes without the teeth and craveling, whereas old man goes without the teeth and also the craveling. But old man had gone through all the circumstances, fine, all the problems, all the enjoyments, but whereas the baby which is coming, they are unaware about those experiences. So as a pediatry comes into existence, okay, and which manage all the diseases, okay, all the normal childs as well as the abnormal childs. Pediatricians ensure the survivability of a normal as well as the abnormal childs. Fine. Now, coming to the first slide, what are the today's lecture outlines? So we already discussed. So before I am going in detail to the neonatal seizure, I am going to just introduce you some of the fact related with the neonate's brain. As we know that the brain development started when the embryo formation is there, because we seen in the inside the mother womb there is a formation of neural tube, and this neural tube differentiate and form the central nervous system as well as the peripheral nervous system. Okay, if you want detailed descriptions, we already uploaded some of the embryology lectures. I will provide the links. You go and watch those videos. So after the parturition delivery, baby's brain is still in developing phase, a rapid developing phase. Got it? Means their neurons, you know that the neurons is a basic a functional unit of the nervous system, and these neurons is in their optimum functional level. Okay, they are in their optimal functional level. What it means? It means they are trying to adapt the new environment, because the previous environment is the mother womb, the uterus environment, uterine environment, which is entirely different from this present environment. Okay, their present environment. Previously, they are free from the microbes, all the sterile conditions. Fine. Apart from that, they are getting the nutritions. Moreover, the neonates which is inside the mother womb, they are developing in the dark environment. There is a total darkness. But when baby comes out from the mother's womb after the parturition of full you can say the full term pregnancy, after the delivery, then baby is suddenly exposed to the bright environment. Fine. But you know that the nature always support humans. Okay, the nature always try to make the humans to survive, okay, to thrive in this world, to adapt the environment. The physiology of the neonate is designed in such a way that most of their infancy time they are in their sleep state, that protect the retina. And not only the retina, you know that the retinal connection is directly linked with the higher system, that's the central nervous system. So initially they protect the retina, but consequently they also protect the central nervous system. That's the one fact. Another fact is that, as I said, that neuron is in their optimum level. It means neuron excitability is higher, it's more. It means if there will be any disturbance in the neurons, that lead to the neonatal seizure and also for the other anomalies. Okay, neurons need a very private zone. They don't want the too much metabolic disturbance. They don't want the toxins to come in their microenvironment. Okay, so as we know that already inside our brain there is something called as brain blood barrier, and that barrier basically conserve, they protect their microenvironment. But sometimes because the myelination is not there properly in the infancy condition, so due to the certain, you can say, disturbance in their metabolic patterns, like some of the child is born with the inborn error of metabolism, some of the childs have deficiency of certain enzymes, and that things lead to the disturbance in the neurons, okay, and end up with the neonatal seizure. Fine, no problem. Now another thing which you have to understand is that parents give their gene in the children, okay, and that gene will express due to the environmental influences, environmental interactions, fine, the physiological interaction, that gene will expressed. But sometimes what happened, those genes become abnormal, fine, and that lead to the abnormal, you can say, the formation of different body parts. So if there will be a abnormal formation of the brain, abnormal, you can say, structure of the brain, and that condition is called as the cerebral dysgenesis, abnormal brain formation. Fine. Now as I said you that sometimes child born with certain diseases, okay, which is like present from their birth time, and that disease is called as the congenital abnormalities, that is called as the congenital, write it down, that is called as the congenital anomalies or abnormalities. And one of the notable example is anencephaly. Anencephaly means baby born with half of the head, okay, or any other brain part is missed due to the problem in the neural tube formation. The cause is identified till yet is the folic acid deficiency. Fine. Now the one thing you are here saying is the neuroplasticity. Neuroplasticity is a modern emerging term, which means we can learn the things, we are learning the things, we are developing the skills, we can adapt the different kind of environment, and that is due to the neuroplasticity. Means our neurons shows the plasticity, means they shows the modification. Got it? This neuroplasticity also help in a very different way. Means sometimes, as I said, that baby is born with one of the hemisphere. One hemisphere is absent. Generally in the humans we have the two hemisphere, right and left hemisphere, which is joined by one structure called as the corpus callosum. So sometimes there will be a absence of those corpus callosum. That means one hemisphere is not, you can say, communicating with the other hemisphere. It means that one area is properly functioning but other area is not properly functioning. But still, without this connectivity, a people can survive. How it is happening? It is just because of this neuroplasticity. Are you getting my point? Or other example is, if you are right-handed, means your left hemisphere is dominant, means you practice the left hemisphere. If you are right-handed, it means your left hemisphere is working. Okay, you know that they are the anti-versally linked. Fine. It means if baby is born with half of the hemisphere, they can still survive if their neuroplasticity is there. Got it? So this is the some basic, you can say, the secret, as I mentioned, that is called neonatological brain secrets. You just remember that your brain is in a highly dynamic state, means brain is developing more. Okay, and one of the condition is their hyperexcitability. Okay, the excitability of the neurons is more. Apart from that, if there will be a cerebral dysgenesis or any gross structural malformation, then neuroplasticity try to manage, but most of the time neuroplasticity will also fail because they are in the infancy state. They don't have the so much, you can say, the metabolic activity. Fine. The learning process is still a new, you can say, the newer. Fine, no problem. Now